number of medical facilities in the country have raised concern over a shortage of antiretroviral drugs in comprehensive care clinics.
Pediatric HIV prevention being most hit following the shortage of two key preventative drugs for 3 months now.
However, Kenya Medical Supplies Authority, KEMSA, has refuted the claims. NTV's Eunice Omolo starts us off.
Paul Ouma has been living with the HIV virus for 16 years now. He is among over 1 million Kenyans on ARVs as their lifeline. However, he recently experienced a challenge in his routine, a shortage of life-sustaining drugs in the form of ARVs at his regular clinic, and was forced to travel to Nairobi County from Homa Bay in search of these critical drugs.
I just came from Nairobi the other day. I had to spend 3 days looking for this drug from one facility to the other, and I had for me to take care of the shortfall because I had to take my drug on time.
In Nairobi County, sources tell NTV that children born of HIV positive mothers are at risk of contracting the virus due to lack of key prophylactics aimed at preventing the transmission of HIV from mother to child.
I have 400 babies. So that's a large number of babies. Huh? By 400 babies, I mean 400 babies whose mothers are infected, but the babies are negative as per the last PCR we did. Remember, we're giving the mothers 1 bottle. Unfortunately, beginning of this month, we no longer have zidovudine. So the mothers come and go home the way they are with all the drugs. So what will be their outcome? These babies will get HIV.
According to National AIDS Control Council HIV estimates of 2018, there are 53,067 mothers on the prevention of mother-to-child transmission of HIV drugs, while 69,497 mothers are still in need of the program. Nevirapine and zidovudine are key prophylactics in use to reduce transmission of the virus from HIV-positive mothers to babies.
So when it ran out of stock, our bosses said we start giving them zidovudine. Zidovudine has a bottle of 240 mils. Remember, this zidovudine, when the baby is born, we give out 1.5 times 2. That means this drug can stay for 6 weeks. But now we're giving up to 9 mils. So the bottle will run out of stock way before the 6 weeks.
A number of counties have been affected, with some medical facilities borrowing especially from private facilities that receive low numbers of HIV patients and donor-funded health facilities.
Same facility run out of stock of a certain drug. I borrow from the nearby facility through WhatsApp. Then that way you will find out it's no longer there.
Efforts by the healthcare givers to get to the bottom of the shortage of the key drugs have been frustrating, as it has been to the mothers who have to make unsuccessful trips to their health facilities for their young ones.
You lie to these mothers until it gets to your nerves. It starts frustrating them because you know you're telling them to come next week, and next week when they come, you know very well it's not there. But you have to tell them so that to give them hope.
Some clients who are reliant on the key drugs have to part with cash whenever they look for the drugs in some private facilities. Sources indicate that Nairobi, Coast and Nyanza counties are worst hit by the shortage, with some facilities having not received the drug for 3 months or more.
It will be a bad scenario. So it's critical that KEMSA comes in to supply the drugs on time.
The Kenya Medical Supplies Authority, KEMSA, has denied any shortage of the drugs in the country, stating that there is a likelihood that the facilities facing the shortage ordered amounts that could not meet their demands. Eunice Omolo, NTV, Nairobi.